The North Carolina Children's Hospital is a teaching hospital. We work in teams of attending doctors, fellows, residents, students, nurses, and healthcare staff all working together for the care of your child. You will meet with a lot of people all interested in and attending to your child's needs while here in the hospital. Let's take a few moments to meet the many members of your care team. The attending is the doctor who guides your healthcare team and has overall responsibility for your child's medical care in the hospital. A fellow is also a doctor who has chosen to take advanced training, often in a specialized area of healthcare. Residents have graduated from medical school and are now receiving clinical training under the supervision of an attending doctor. First-year residents are often called interns. They are available 24 hours a day, 7 days a week, and maintain close contact with you and your child. Medical students work closely with our residents, fellows, and attendings and are carefully supervised when providing care. Nurse practitioners and ward team coordinators are also members of the team caring for your child. Doctors may rotate on and off our unit during your child's stay here. Your nurse practitioner or ward team coordinator remains on your child's team throughout their stay, helping ensure a smooth transition from the hospital to your home. They will also update your primary care doctor on your child's plan of care after discharge. Members of the team will be coming to your child's room to evaluate your child and update their plans for care every day, often in a large group. Do not hesitate to ask what each person's role is if you are unsure. This is your child, and we invite your questions and involvement. Each shift, a nurse is assigned to your child, giving them responsibility for coordinating and implementing your child's bedside care around the clock. The nurse will also teach you about your child's condition and care, coordinate your child's tests and procedures, and constantly monitor your child's health status. The nurse will also help you understand your child's plan of care. The nursing assistant is also specially trained and is one of the most frequent smiling faces you will see, working closely with the nurse and you to meet your child's needs. Health unit coordinators, called HUCs, provide clerical support for each unit. They provide support for admissions, transfers, and discharges. The HUC can answer many of your non-medical questions. They work closely with the nursing staff to communicate patients' and families' requests. They are often the voice answering your call bell when your nurse is not immediately available. A charge nurse assigned for each shift keeps the unit running smoothly and efficiently while providing staff with the resources and support needed to make certain your child consistently receives very good care. Nurse managers are responsible for the overall leadership and operations of the unit and supervision of staff members. They are a resource for patients, families, and the healthcare team. Your patient information folder will have a welcome letter from your nurse manager and contact information should any needs arise. Clinical care managers work with you, the healthcare team, and community agencies to implement the plan so that it works for you and your child. The clinical care manager will discuss with you the services and equipment your child may need. Housekeeping provides daily service in your child's room to remove trash, clean your bathroom, mop your floor, and assist with other housekeeping requests you may have. A patient nutrition representative will come to your room at mealtimes to provide your child with a meal tray. Mothers who are breastfeeding and staying in the room will also be provided with meals. Please speak with your nurse about any special dietary needs you may have. Depending on your child's diagnoses, other healthcare professionals may be involved in their treatment. Please refer to the Patient Information Handbook for a description of their roles in your child's care, or speak with a member of your child's healthcare team. We see the parent or caregiver as the most important member of your child's healthcare team. The information you contribute to your child's plan of care is vital to the success of the plan. Your support of your child's plan of care and being at your child's bedside helps your child heal. Evidence and experience have shown that teaching you about any special care requirements your child needs following their discharge leads to more success when your child returns home. So, we welcome and encourage your questions and ideas. Rounding times vary, but do take place daily. If you are not here when your child's team rounds, A member of the team will provide updates and answer your questions as needed.
Yes, her mom wanted to know what kind of medication she'll be on when she goes home.
Our goal is to provide care in a way that does not interfere with your child's normal routine, like during naps or mealtime, and we provide care 24 hours a day. We make every effort to perform these types of assessments at times that are convenient for a sick child. But you should expect vital sign checks at night and blood to be drawn in the early hours so it can be tested before the team make rounds. By doing so, the team can make treatment adjustments as needed in your child's care, with the objective of moving them to wellness and home again quickly. There are also things you can do to help us assess and monitor your child's status, such as keeping track of what he or she drinks and saving all soiled or wet diapers. The nursing staff will discuss these needs with you. It may take several hours from the time your doctor tells you that you can go home to the time you actually are discharged from North Carolina Children's Hospital. We work hard to keep this time as short as possible. Some things that may need to take place before you can leave with your child on the day of discharge are: remaining test results may need to be received and reviewed. Family education may be needed, including a review of your medications. Follow-up appointments may need to be made. Prescriptions may need to be written and faxed to your pharmacy of choice. And discharge orders and instructions must be documented in the chart, not just verbally given to you by your doctor.
Our goal is to provide you very good care. After discharge, we may contact you through mail with a survey. Please take time to give us your feedback. Your comments are very important to us as we use the information for improvement and for staff recognition.
Thank you for choosing North Carolina Children's Hospital.